Good afternoon and welcome to Bariatric Friday. My name is Kemal Erkan. I'm the chairman of American Surgery Center. And I am here with Dr. Isaias Irgau. Dr. Irgau, how are you doing?
I'm doing great, Kemal. Thank you.
So Bariatric Friday is the only weekly healthcare show in the state of Delaware. I will probably go with larger area, but I'm not 100%, but let's say that maybe 90%, we are the only one probably in the East Coast. So when we discuss healthcare related issues, it's always important to have an expertise joining us, and Dr. Erkan's role is to educate us, guide us, and elaborate certain issues that we are dealing on the morbid obesity issue. Now, the obesity is affecting 42% of the United States today. So as we are being affected by obesity, we have this show trying to address the issues that we have for those patients who are going through the bariatric surgery, which only 1% of the patients who are qualified to get surgery. They get only 1% of those people are getting it. So this is the most effective tool to fight morbid obesity. Yet there's still so many different issues. So we try to cover different topics around morbid obesity, but one of them that we added in the last couple of rounds is the social stigma of morbid obesity. And the things that's affecting us in life, not just one group of people, but everyone. And we try to understand and also maybe put a light on those issues to see if we can help our patients throughout this process. A couple of weeks ago, we discussed the patients who drop out the surgery process, like last minute, they complete 14, 15 checkpoints. And then last minute, they shy away from it because there are different cases, issues. One big one is still the stigma of morbid obesity. The stigma is a discriminatory act, ideology targeted towards individuals because of their weight and size. This is from the obesity side of it. So people are being discriminated just the way that they look, the way that they live their lives, the way that they travel. And we at this show believe that it's our obligation to cover certain issues and also be an advocate for our patients and the population who are struggling with morbid obesity. So Dr. Irgau, again, it's always good to have you in part of this show. This used to be your show anyway. I stole this from you, right? So
it's our show.
It's important to be able to be available every week, and also I feel a lot more comfortable when clinical information comes from a surgeon in the bariatric side. So if you can tell us what you see from your point, and I'll have a couple of videos that I'm going to play later on, but we can start with you first.
Absolutely, absolutely. By the way, Kemal, I am absolutely delighted to be here every week. It's really one of my favorite times of the week, no question. You raised this definition of stigma, right? And when you look at that definition and think about bias and discrimination against people who struggle with weight, obviously it's morally wrong. It's morally wrong that a person, just because they appear to you in a certain way, that you should have a bias against them or discriminate them, or you should have less respect of them. So from a moral point of view, it's just not acceptable at all. And from that point of view, actually, discrimination against obesity is probably the most accepted type of discrimination we have in our society. I cannot think of any state where discrimination based on weight is actually illegal. We have lots of other discriminations which are illegal, right? But not based on weight. It is accepted, right? So that is by itself morally wrong. But stigma against obesity has far bigger consequences, particularly from a healthcare point of view. First of all, obesity is continuously on the rise. And based on the numbers that you mentioned in your introduction, we're approaching a level where half of the US population is going to become obese, right? Obesity is related to some very critical health conditions that affect our longevity, whether it's heart disease, whether it's hypertension, whether it's type 2 diabetes, or others. So from a population health point of view, obesity is probably the most significant health problem we have in our society, right? And yet, if we have this attitude of bias against obesity, how well prepared are we then to tackle it and have a dent on it? Surprise, surprise, we have not. Every 5 or 10 years, we come up with plans to achieve a certain rate of reduction of obesity. And then we look at the numbers and we see that not only we have failed, but obesity is still on the rise. And there's no question. In part, this failure may be related to the fact that we have this attitude towards obesity where not only we don't see it as a disease like other diseases, but actually we discriminate. We look at a person in front of us, whether we are healthcare workers or other responsible people in society, and when we look somebody that is obese in front of us, the idea that comes in our mind is somehow that person is responsible for who or how they are, and therefore we don't have a responsibility to help them, particularly at healthcare workers. And this may have something to do, Kemal, with our views about a thin person, right? In our culture, we think about a thin person as somebody who's hardworking and disciplined. And automatically, when we see somebody who's not thin, the reverse comes to our mind, the discrimination, the bias, and the stigma. So not only we are really failing morally by being, having this bias against obesity, but actually in practice, we're failing to tackle an extremely important health problem in our society.
So, Dr. Irgau, part of what I try to do in this show is to make our patients understand that we all struggle with issues day to day. You and I, we were at ASMBS Bariatric Health Conference Sunday through Wednesday this past week. Yeah. And because we talk about these issues and the social stigma of morbid obesity, and we also see what it is that people are complaining about, what they go through, what are the challenges that they kind of highlight in mainstream media. So, but just so that we kind of have some taste of social stigma is men and women living with obesity are lazy and irresponsible. This is the social stigma of examples of the social stigma of morbid obesity or obesity. People carry extra weight because of their choices. A larger body size is unattractive and undesirable. Overweight people, most of them are not very smart. And overweight people have poor hygiene and less capable of doing things. So this is a really stiff, mean, evil list of ideas. You don't want to think of anyone in this way, but just because they're chronic illness, especially, you should definitely not be thinking about people that way. Now, there is a fine line that at least personally I'm going to put myself out there to make sure that people understand. We don't want to, especially when I look at this one, a larger body size is unattractive and undesirable. When it's the healthcare, the health of that person, well-being of that person is important. In some cases, which we covered in this session before within the show, some people take this to a different extreme and then say that, now you are going to celebrate how I look. Versus there are people who are the haters. What we are trying to say is that I don't believe, at least personally, I don't want to be part of celebration of this in terms of making this a good choice for people, because it's not, because this is a disease that needs to be treated. However, we do not want to allow people to go after these individuals who are struggling with this disease. So there's that fine line that I put there, so that sometimes becomes a little bit difficult to walk on that. So here's an example. So I'm going to actually play a personal video of mine, and maybe I will be violating some personal issues here, but try to watch this. And now, Dr. Do I have morbid obesity?
No.
No. So I'm probably overweight, but not obese yet. I don't have obesity. So hopefully you're not trying to say these just to make me feel better. But I'm going to play this video. And while you were sleeping on the plane, I was working.
You're always working.
This is an airplane in the United States. We took this on the way back, and I want you to kind of look at how people are being sitting, how they're sitting, how kind of like they're stuffed in those seats. And not many of those people were either obese, they didn't have obesity or morbid obesity, not all of them. But look what we are looking at. So here's, I'm in the bathroom of the plane. And I took this video to show you, I couldn't move in this toilet. I'm 6'1" and 217 pounds, maybe 225. But here's how much room there is. And look, I'm gonna struggle. I'm trying to turn and turn and turn. And I squeezed in there, so like I have nowhere to go. So now let's see a little bit more. And here it's me. You can see now the American Airlines can sue me for taking this shitty flight that they had. And this is the airport, by the way. Flying in this country is already a big nightmare, unfortunately. And this is not true for the rest of the world. And this is what we saw. And then we waited about an hour to get our luggage at Philadelphia airport. So now you all saw that, right?
Yeah.
And those who didn't see everything, go back and watch it again. So, and as I was doing it, I was a little bit careful. I wasn't, I don't want people to feel uncomfortable. And then I also, putting it out there, who knows, sometimes these airliners are doing, but the problem was, we were in the business class and I had hardly enough leg room. And that's one of the reasons I want to go back to see how small the economy is.
Yeah.
And when did that become the standard? So do we not have, the airline companies, do they not have any responsibility in how anyone is feeling? So clearly Turkish Airlines business is twice bigger than what we saw with American Airlines. Why are they able to do it, but then we are not here? We were way more advanced than Turkey, and we still are. Why are we pushing our people to sit on those shitty seats? And now someone a little bit larger, someone who's pregnant, let's say, who can't just sit in one of those seats. There's no way. It's inhumane.
Right.
It is inhumane. This is not about like one of the reasons this issue got to this point is the price. I mean, the plus size people they call now on the mainstream media, and then like they should be paying more for the seats, or they're maybe paying more with some airlines, but then make better planes, like make larger, humane planes. This is something that we definitely need to address. So imagine, Dr. Now, like the standard car that someone is getting has a seat that's half size of today. That's how the airplanes are right now.
Yeah, absolutely.
Are we expecting those types of products in the future? Is that where we are going? So then I have to put myself in one of our patients' position to see if I wasn't able to afford business class, number one, because there's a big price gap.
Yeah.
And then now I'm on the back seat. Not only flying is so bad and so uncomfortable, but now I'm embarrassed because everyone is looking at me. Everyone is like looking at me, don't sit next to me, don't sit next to me. Like that's the environment that we set up for those individuals who are dealing with this chronic illness. I think I want to kind of like look at it from that point to see what your take on that.
So that's a very important point, Kemal, because it really reflects in reality what your introduction was, right? So the key here is that, you know, the space in that airplane, the seats in that airplane are clearly not adequate for somebody who's struggling with weight, right? But they are okay to go ahead and do that because nobody will take seriously and support a complaint that comes from somebody who's struggling with weight. Why? Because society is not interested in that, right? There is this intrinsic bias in thinking, you know what, you're struggling with weight, it's your fault. Go out there and fix it yourself, right? With that type of attitude, no matter how much I shout and I have protestations in the streets, nobody is going to sympathize with me because society has this intrinsic bias against me. But what is worse for us, Kemal, is that bias in society is even reflected in the healthcare sector, where people are not getting adequate access to care, right? If somebody goes to their doctor, the first thing the doctor or the provider will see is their size. And whatever complaint that person they may have, the first thing they may say is, oh, it must be your weight, rather than look at that person as a whole. Yes, of course, the weight is associated with many illnesses, but that should not be necessarily the first thing for them to think unless they are biased against that person. But more importantly, even when they think it's the weight is the problem, they don't take the ownership of helping that person, right?
Mm-hmm.
They don't say, okay, obesity is the central part of your health problems. I am going to help you by doing X, Y, Z. How many doctors actually refrain from sending somebody for bariatric surgery just because they see, oh, this person doesn't deserve it because hasn't made any effort at all. They haven't done anything to lose by themselves. Therefore, I'm not going to send them for bariatric surgery, right? This is seen time and time again. Come on. So with that reflection, we really are fighting a very uphill struggle in getting people actually to become healthy because we do not understand that they are dealing with a disease. Anybody who thinks obesity is not disease in this day and age is flatly wrong. Come on. Data is coming out time and time again that we all have different response to energy intake and energy expenditure based on our genes, come on, which means that there are some people who become very heavy no matter how much they work hard and they eat healthy. And there are some people who couldn't really be bothered to do any of that and they will always be thin. Granted, these are the two extremities of the spectrum, but the basis here, Kemal, is that there are so many mechanisms that are totally out of control of our conscious understanding and conscious behavior, right? That determine where our weight should be, right? And that is our problem. Yes, of course, this is magnified because we're living in a society which is obesogenic, meaning that it is really a setup for us to become obese, but the platform for that to occur is within our biology. And nobody, Kemal, nobody is responsible for their own biology. Our biology is what we are given, right? But people don't look at that way. When people look and sympathize, against discrimination based on skin color, they say, oh, well, yeah, you cannot discriminate because that person didn't choose their skin color, right? But when it comes to obesity, they say, yeah, that person chose to become obese. That person chose to become heavy, and they don't.
So sorry, but I think it's right there. It's a really important way that how we deal with patients with diabetes in our program when we do the lab work, and then when the A1C is 12, patients not being diagnosed before by their primary or other healthcare providers. We freak out and then put that patient with the endocrinologist And our endocrinologist, Dr. Ripanda, opens his office on a Saturday to accommodate those patients. So it's kind of like, if you think about it, Dr. Like, so interesting when the diabetes is a chronic illness and our reaction to that really high A1C, that takes us to this, okay, this is extremely severe, so we have to do something right away, versus I have a patient with 55 BMI coming in, and I'm like, oh, I'm not going to hurt her feelings by telling them that they have morbid obesity. This starts in medical practices. I think the stigma, perhaps how we are going to overcome this it has to start in the medical practices. The doctor should not be worried about how patient is going to feel about a diagnosis that we are diagnosing them. They should not be worried about that. Of course, their bedside manners is important. How we are delivering this message is important. But when we let this go just because we don't want to hurt someone's feelings is not the right way to practice medicine. The reason I'm highlighting that is because that's where it starts. Because if the doctor feels shy about it, the people, average Joe in at the local bar is going to be making so many jokes about these issues. That's where the problem is. So when like I'm a little bit like agitated after the travel, like to also understanding how bad it is, how bad it can be. Just imagine, like you are dealing with this and you are going through this. It happens to our patients. So someone's family emergency, someone has a family emergency. Now they have to fly while they're going through the process of getting bariatric surgery. Patient with 52 BMI has to be in the economy class in those airplanes. It's inhumane.
Absolutely.
I mean, I think morbid obesity, people with morbid obesity should start a class lawsuit against the airliners. That is inhumane. So I'm telling you, like, that is not right. So that's not just from that. This is from everywhere else. Now, the reason we are also discussing these, right? So what happens when people are going through these, discrimination is something, unless you kind of have a first-hand experience, you may not really relate to this. Yeah. And just earlier, in the earlier session, I was explaining this to Sean. Like someone may be looking at me and saying that, well, he was probably not discriminated in his life. That's wrong. So twice in a row at a shooting range, I was discriminated by people who don't think that I should be there because of my last name, my first name, and my religion. And they made me really uncomfortable. I felt like I was going to be attacked. That feeling is extremely scary.
Yeah, absolutely.
And also, you start worried about these now. So then when this next thing is going to happen, who's going to do it, this and that, and then this low self-esteem, negative body image, depression, anxiety, poor quality of personal relationships, poor pay at work, and fewer promotions, and then developing eating disorder, and so many other impact of this is almost making a huge. It becomes a huge handicap for the society that we live in.
Absolutely.
So if we don't take care of this, and I think one of the best ways, Dr. I don't know how you think about this, but education and providing more education on this, and I think you and I, we have done our fair share.
Absolutely.
And that's why we are here. But anything that you want to kind of cover related to these issues that patients may be dealing with?
Yeah, absolutely. So, the key for us, Kemal, is that unless we are able to overcome this bias, we will be unable to really have an actual impact on the treatment of obesity in our country. It is no surprise that when we have the most effective treatment for obesity right now, bariatric surgery, very safe, right? High level of quality and safety. And yet barely about 1% of people who actually would benefit from the surgery are coming to seek our care. And there is a problem there. And the problem is access to that care. And I don't mean access to that care, meaning that, insurance issues and others, although those are real as well. It's really even people getting up and saying, I have a disease, I need a doctor to help me, because there is nobody supporting them to do that, right? We always bring the example of a family member who tells his loved ones or her loved ones, oh, I have cancer. My doctor told me I have cancer. Everybody will be rushing to help them, to support them, to say, when is your surgery? When is your treatment? How can we help? But if somebody says, oh, my doctor told me I have to have bariatric surgery, people will say, really? Do you need that? That bad? Why could you not do it yourself? So all the negative hints. So people just don't go through with that. And on top of that, obviously, even us within the healthcare system have not been able to see through the issue as a disease and have not been upfront in terms of recommending the treatment as necessary. But as you said, the more we talk about it and the more this issue comes up, we will make headways.
And I think we will, Dr. Erkan. So I believe that we are taking this extremely seriously. And also, this is the culture, clinical culture, maybe, that we are changing in our accountable care organization in United Medical. And I do also believe that we are way ahead of the others. Our goal is to bring those who are behind to the same level, because this is not just one group doing better than the others. This is the society and how proportionately we benefit from what we are doing, and will be available, and we'll make sure that people are being supported throughout the process. And even if they don't decide, and if maybe they make some other decisions in their life to better take care of their health, we are going to be here to guide them. And hopefully people are enjoying this and they get the support that they were looking for. And we'll be back next week with another topic. This is the week of, we are going into the holiday week, 4th of July. Happy 4th.
Happy 4th.
The holidays are important time offs for us. So being sensible and reasonable while you are partying and eating and drinking, you don't have to be dealing just with, just because you have morbid obesity doesn't mean that others, if you don't have it, that doesn't mean that you can do everything. Being responsible, reasonable, and sensible are important things to remember, and rest you can just enjoy it. Thank you so much for joining us, and we'll be back next week. Thank you.